We want people to be able to thrive in their workplace, not to survive the working experience. And it's important that we are constantly looking at evidence-based guidelines which can guide our employers to really create great workplaces here in Western Australia. We know a lot of people's lives are determined by their working life. And so it's important when you talk about mental health and well-being that you are talking about not only the broader issues in our community, but how people interact in the workplace.
What's unique about our initiative is that we are focusing on work in the mental health place. There are many initiatives such as Are You OK Day and so on, but our focus is on actually looking at the quality of work people have. So what can organisations do, and that's really our goal, is to support organisations in addressing mental health issues in the workplace. So what can they do? First of all, they can put in place systems and practices so that we can identify people who are vulnerable, people who are suffering from mental ill health, and ensure that they've got the right access to support and treatment. And many organisations are increasingly doing this, which is terrific. But more importantly, and something that's actually neglected in organisations at the moment, is that we can actually create work that prevents the emergence of ill health in the workplace. So if you have work that is excessively demanding, or you've got negative leadership, or you're micromanaged, or there's a lot of downsizing, or you're on temporary contracts, these are all factors of work that we know from a lot of research evidence can cause people stress. So it's really important that organisations actually not just focus on identifying and treating ill health, but preventing the emergence of that ill health in the first place through designing good work. We also want to emphasise that it's not just about eradicating stressful aspects of work, and that's important. It's also about creating workplaces in which people can flourish and experience well-being. So when work is good, it's an opportunity for people to connect with other people, it's an opportunity to feel competent, it's an opportunity to feel that you're making a difference. So when work is good, there are all sorts of positive benefits that employees experience. So we're concerned to try to move the emphasis away, or to go beyond at least focusing on identifying and treating ill health, to creating work that is actually healthy, productive, engaging for employees. There's some research that suggests for every $1 that's invested in strategies to improve mental health in the workplace, you get at least a twofold return. And the purpose of this project really is to help organisations to make that initial investment and to get the value as a result.
Mentally healthy workplaces are really important in the helping professions and for people that are supporting families, and in our case women and their families who are often dealing with really traumatic, difficult experiences. And the health and well-being of my staff and our staff is really vital to that. So overall this has been really exciting to be part of, and it's certainly starting to make a cultural change in our workplace.